sarcomas taught us a lot about how powerful words are. The diagnoses drive the way people treat them, and by giving them more defined and more precise diagnoses, we can then match the clinical trials and the options for therapy to a more precise group of patients. So sarcomas really led that way that we're seeing now in all other cancers. In our world of sarcomas, we're again seeing that kind of convergence. We're seeing the targeted therapies take off. The first proof of concept of the TRK inhibitors was actually in a sarcoma patient who had a TRK fusion. So those things we knew would happen, and certainly they're having some reality check in real-world efficacy data now from our clinical trials. We haven't seen anything much yet about the immuno-oncology space. There will be more of that at ASCO from our group and other groups, and there are going to be good opportunities there, just as there are in every other field of medicine. So the convergence of targeted therapies and immuno-oncology, the other place sarcomas are really leading the way, I think, are in the epigenetic space. The data on the malignant rhabdoid tumors, epithelioid sarcomas, and synovial sarcomas are going to lead the way with the EZH2 inhibitors and others epigenetic drugs. And then finally, the recent breakthrough therapy designation of the engineered T cells with the technology that comes out of publicly funded science at the NCI, but now has been taken into the company called Adaptimmune. Very exciting work in synovial sarcoma patients, and really just the tip of the iceberg, because you can engineer and optimize a T cell to recognize almost anything you want. So the fact that we're going after NY-ESO-1 is something that's highly expressed on synovial sarcoma is really just a big toe in the water as we get into this field of what our institution is now starting to call the cellular pharmacy. The idea that we're using living drugs rather than just static drugs you pull off the shelf. So I think, as an oncologist, there's never been a more exciting time to be taking this toolkit forward and change practice.